Welcome to the Wellness Connection with Dr. McMinn. Dr. McMinn is Birmingham's wellness doctor, practicing cutting-edge, world-class wellness medicine at McMinn Clinic in Homewood, Alabama. Each week, Dr. McMinn interviews experts in the field of integrative wellness medicine. The Wellness Connection brings you the information you need to optimize your health in mind, body, and spirit. And now, here's Dr. McMinn.
And welcome back to the Wellness Connection with Dr. McMinn. I'm here as usual with Misty Walraven, our moderator, and we're talking today with Dave Kolatzik, who is with Watermark Medical, and we're talking about sleep apnea. We're going to get into his very interesting device, the Watermark Aries home sleep monitor. But before we do, Dave, let's just kind of wrap this up. I think Misty had a very interesting point during the break.
Yeah, Dave, I was just wondering, you don't necessarily have to be obese to have sleep apnea, correct?
Correct, absolutely not.
Yeah. Although it does make you more likely. It's interesting, Dave, too, that something on the order of 20 million Americans have obstructive sleep apnea, and yet only 5% have been diagnosed and treated. Isn't that amazing?
It's incredible because I think so many times the primary care physicians are dealing with things that are much more obvious, like the hypertension and the diabetes, the atrial fib. As we enter the cardiology arena, typically you just see the incidence of sleep apnea go off the chart.
For real. You know, Misty, we're always practicing functional medicine in the office, aren't we? And so when somebody comes in with hypertension or obesity, we should think to ourselves, okay, why do they have that? What's causing that? And we should be thinking, okay, are they having obstructive sleep apnea? So I guarantee you, most people who get on hypertensive medicines or are obese are not getting tested for sleep apnea.
Right.
Correct.
So they should be tested. So let's kind of segue into talking about testing. You guys have a fascinating device. It's been out for a couple of years now called the Watermark Aries home sleep monitor. And we have used this in our office with great success. I'll tell you a quick little story. I remember back a few years ago I had a patient who I ordered some sleep apnea testing on him, sent him to the sleep lab. And he just went crazy. About 1 o'clock in the morning, he tore off all the equipment and went home. And they never could complete the test. He just the whole sleep lab experience was just so negative for him.
Absolutely,
he couldn't stand it.
I wouldn't want anyone watching me sleep.
Yeah.
That's just uncomfortable.
I mean, there's a time and a place, and those guys do a wonderful job. They're experts in the field, and I appreciate what they do. But I think patients need to know that there's another option out there.
Absolutely.
So tell us, Dave, about the Aries device. It's a fascinating device, high tech. I think it really takes advantage of the amazing modern technology we have. And so tell us about the device.
So the Aries device, Dr. McMinn, was actually cleared by the FDA back in 2004. So the technology has been available for a while, but as we often have in healthcare, until there was a shift in insurance policies and reimbursement and mechanisms and things like that, it kind of remained a little bit unknown. In early 2008, Medicare made a key decision, and they recognized home sleep testing as being as accurate as polysomnography, the sleep lab, in terms of getting a patient diagnosed and then into an appropriate therapy mechanism.
Well, plus there's such a lower hurdle, I think, that people have to cross over. I mean, to do this in the comfort of your own home, in your own bed, is, wow, it's first of all, more cost effective, but it's just so much easier for the patient.
It is, because that patient, not only you've got the expectation of sleeping in a strange bed, even if you make it look like a hotel room, which is very common, and the labs do a great job at trying to minimize that clinical impact when you walk into the room, yet you're still out of your own element. And many people don't even sleep well in a hotel if they're traveling on vacation, and so it's completely different sleeping outside of your own bed.
So, Dave, data doesn't help you if it's poor quality data. So I assume there have been good studies that have been compared this to a gold standard and found that it is as good as far as diagnosing sleep apnea, correct?
One of the classic validation studies in CHEST, one of the more reputable medical journals from 2005, found that the statistical correlation in terms of diagnosing sleep apnea between polysomnography, the lab if you will, and the Aries device was at 0.96.
So that's
1.0 being perfect correlation. So that really put the device on the map.
Well, absolutely. So that basically tells us in layman's terms that it's really, as far as its sensitivity, it's just as good.
.04.
For all
I mean,
practical
that's-
purposes,
yeah.
just as good as the in-hospital or in-lab sleep monitor.
And that was
Yeah.
one of the key
Yeah.
reasons for Medicare, and then hence
Right.
many of your other commercial
Yes.
carriers saying, thumbs up, this is
Right.
a good thing.
Right. So basically, we use the device in our practice, and so it's a very small little device that the patient wears. We kind of custom fit it to wear on their forehead. There are no wires hanging off, right?
Exactly.
And basically, it's all
And a little computer.
in a little an amazing computer that can tell all sorts of things. Tell us all the stuff it can tell you, Dave.
So it can, almost think of putting on a ball cap.
Right.
For the course of the evening, weighs less than 4 ounces. You'll put it on immediately before you go to bed, turn it on, hear a couple of audible prompts which will guide you through it. Then the data that we can capture during the course of the evening will run the gamut from oxygen saturation and desaturation, heart rate, movement, airflow. We can differentiate with EEG capture, REM versus non-REM sleep.
Yeah.
So this is all occurring, and the patient is comfortably sleeping in their own bed.
Oh, that's amazing that they can do that in such a little device. I've always felt, Dave, I think when it comes to modern medicine, for some reason, we're way behind the curve when it comes to technology.
Absolutely.
And so here's an example of I forget the name of the guy who started the company, but what was his name?
Dr. Philip Westbrook, really
Exactly.
one of the luminaries in the world of sleep
That's
medicine.
right.
It was his vision
Right.
in 2001 to have a
Right.
very cost-effective,
Right.
easy way to diagnose this disease.
So here's somebody who has decided he's going to use technology to its fullest to come up with a much more cost-effective and yet reliable source of information.
Absolutely.
Because if you make it too difficult and too costly, what is the average cost of a in-lab sleep test?
So in-lab costs per night, Dr. McMinn, can literally run the gamut in a hospital setting where
Yeah.
they're able to bill more
Right,
because that's
right,
the nature
right.
of what it is. It can be anywhere from 2,000 to 3,000
Yes.
up to 4,000 per night.
Yes.
A patient more than likely will have a 20% copay as
Right.
well if they have unmet deductibles. So,
Right.
and this is times 2. A traditional
Right, times 2.
sleep study would be a
Right.
2-night process.
Times 2. So therefore, yeah. So we're looking at 2,000 or 3,000 a night. Now I know I don't know what your other docs do, Dave, who have the thing, but we charge patients. Let's be really upfront with folks as far as what this will cost. It costs about $275, and that includes everything: the reading, the whole works. And so, wow, what a cost differential! And we all need to take ownership for this high cost of medicine. We see the cost of healthcare spiraling. Yeah, and here's something that can reduce the total cost of testing by a fraction, a tenth of what it was.
Literally a tenth, and
A
it
tenth.
ties so well to the tremendous shift in
Right.
healthcare from high cost diagnostics to something that is just as effective,
Yes.
and yet we can rein in that cost.
Yeah, which is I think a win-win for everybody.
I think it's a
Absolutely.
no-brainer, and
Yes,
you can
yes.
take the report that you get from the Watermark device and get the appropriate CPAP or device, whatever that you need, right?
Correct. So we're the diagnostic component. Dr.
Right.
Min will receive that
Right.
report, and then we want to prescribe the drug, if you will, and that drug would be either CPAP or AutoPAP. That's simply an acronym. CPAP is an acronym for Continuous Positive
Airway
Airway
Pressure.
Yeah.
So
Right.
these are the masks that people will wear at night that literally will create a pressure. And
Yes.
that air pressure will keep the airway open, hence dealing with these obstructions and restrictions that we would have.
And some
Yeah.
people don't even need that much. They just need a little device that maybe keeps the tongue from falling back in the
Sure,
throat. So it can be
absolutely.
as simple as a device that you get from a dentist,
It
or
could be,
it can
absolutely.
be as
Or oral appliances really
Right.
address the need for, where we have a mild or moderate patient that works well.
Okay, well, we're going to take another quick break on the Wellness Connection with Dr. McMinn, and we'll invite y'all back on the other side. We're talking about sleep apnea and the home testing device, and we'll see y'all in a minute.